Alright, good evening, guys. It's actually 6 o'clock for me again when I'm making this new video. So, the last cover update I did was 2 weeks ago. A lot has changed. I just got into college this week. So, already starting to see some of this in my personal life where people are coughing and for some people, the coughing isn't that bad. Although I know for COVID infections, at least half are asymptomatic, so they don't show any symptoms at all. But for those who are symptomatic and who are in school, they do cough pretty badly. They are coughing pretty badly. And even though that is happening, they go right back into talking to the person next to them. So I can already pretty much guarantee who's going to be sick next week, who's going to get infected. So today I have more time to actually make the video. So here we go. I'm going to start my timer now so I can lay out all the timestamps. I should actually do this before, but we'll start now. Okay. For daily infections in the United States, we are currently looking at about 1.4 million infections per day. The peak nationally is this week. It may be a little bit higher next week, but it's expected to be this week according to Michael Hoger's data. And he's from the University of Tulane, which is in Louisiana. So currently we are here. This purple is the forecast. The orange, red is where we are right now. Currently, 2.8% of the United States population is actively infectious with COVID. And you could roughly think about half of those people won't show any signs. So you may think that you're around someone who's perfectly healthy, but you get sick as a result. Or you may not even notice it. But it is important to keep in mind. So, the United States is into the ninth wave of the pandemic, which at 1.4 million infections a day in the United States may wind up as the largest summer surge of all time. The previous summer surge, which was in 2022, is also around this margin, a little bit higher, but the number of infections could easily be larger than 2022, as the curve downward after the peak is not as large as it was in 2022, it seems to be. Now, nationally, we do know that the West and the South have probably peaked already. Peak transmission in the Western United States, I believe, was around 4.4% of the population was actively infectious. That's down to about 3% now, which is still very high, but it's not at the 1 in 20 people infected back in early August and late July. The South has also come down from its higher point earlier in the month, but infection rates are still very high and should remain so for the rest of 2024. I'm in the northeastern United States and in northeastern United States, so Midwest and Northeast are related. Transmission in the Northeast and the Midwest has been lower than South and the West, but cases are still increasing, especially since school just started, so prevalence should rapidly increase in the Northeast and the Midwest due to the peak is approaching as schools opened up. So that's opened up the amount of people who can be infected in a short amount of time because schools aren't very proactive actually dealing with infection. So they actually help spread it a lot more than if the schools were closed at this time compared to the earlier in summer. So this is where we are right now. CDC levels, these are this is viral activity for COVID-19 on the left. Omicron, the highest it was 31.8, and this is when we were at 5 million infections per day if we looked at wastewater. But this was a very sharp wave. This is a perfect storm kind of wave. The vast majority of COVID waves that are large, like the one that we have right now, in the United States all get above 1 million cases a day and are somewhere around 1.5 million cases, and in the case of last winter, around 2 million cases. Almost all the other summer waves, besides the 2022 one, were below 1 million cases, whether it be EG5 last year, which is August 2023 right here. So I'll highlight it here. August 2023 into September. The Delta variant back in 2021, and this little summer surge back in the summer 2020. Going along, at least with how this data is factored in, 60% comes from the CDC, 40% is using BioBot data. BioBot data is harder to acquisition because they do no longer have that interactive dashboard, But that is something to keep in mind. They don't have the dashboard anymore, so there's more sources mixed in to make this model better overall. West and South are peaking and heading down. That's the main thing from this update. But cases are still very high. Make no mistake about it. And the Midwest and Northeast are increasing faster. So, right now, the Midwest and Northeast, where I am, are increasing faster than other regions are decreasing. Other regions of the United States have decreased by around, I think 0.3 to 0.5% a week. No, I think it's close to 0.3% per week of active population that's infectious. Whereas in the Northeast, where I am, the amount of people who are becoming infectious is increasing much faster than that. So the overall peak of daily infections is going to keep going up. This week, and peak around this week or next week, and then slowly go down. But it's not going to go down very quickly or very low. Mainly due to back to school, and then eventually, since this is uncommon for back to school, since all other years have been lower than this will also have a higher ceiling for when we get into for when we finally get into the fall and election day. Because we have Halloween, then we have election day. Those can be two very big super spreader events. And then we get into Thanksgiving, and then finally we get into the Christmas holiday season and into the new year. That's a bit far away from now, but just letting you guys know about the timeline, that's not that far away. Plus, we just had Labor Day, so that's probably also helping these numbers. This is a year-over-year comparison. Schools and businesses that lack multi-layer mitigation, vaccines, masking, excellent indoor air, better than CDC isolation guidance testing, should expect illness and absences. This pretty much is going to happen. I've seen illness. I haven't seen absences yet, but I expect these to start going up eventually, as people who actually do care stay home, or those who are too sick to go stay home. But here's the year-over-year COVID-19 transmission in the United States since 2020, which is year one, and the median, which is this gray line here, if you guys can see it. This gray line is the median combining all 4 years, excluding year 5, which is the year we're currently in right now, the pandemic. So, from that perspective, what we usually see in a typical year, because 2020 doesn't play too much of an effect into this, ever since about 2021, and especially 2022 and after, there has been a decline in the spring. A decline in the spring usually, followed by a summer surge that peaks in September, and then you have a small plateau in the early fall that's centered around 700,000 cases a day in the United States as you get into November. And then you have this sharp incline as you go into late November, into December, into the winter. And then that shoots you up to a large wave that's around, at least if we include Omicron does boost us up a lot. But if we include 2022 and last year's winter wave, which were pretty large, because all the top 5 largest waves in the United States have been after January 2022. From January 22 onward, the median would suggest that around late December we should have cases around 1.8 million a day. Omicron does affect this a bit, so this should be a little bit lower. But usually a winter wave at peak will be about 1 to 2 million cases a day, and that will roughly mean that about a quarter to half of Americans would get infected during that wave, with about 50 to 60% of those infections being after peak. So the majority of these infections wouldn't be before January. These would be January and afterward until you get into March and we restart the cycle. Barring there's no new variants or anything. Now, close-up forecast. This is where we've been over the past year. This is last year by comparison. This was the summer wave last year. This was XBBB EG5 before JN1 really took over. BA 2.6, where we had to update vaccines this year. So, This is where that was, and this is where we are right now. Nationally, we are much higher than where we were last year. Last year's wave was equivalent to the size of Delta in terms of infections. So this is where we're roughly at. 1.4 million infections a day. The peak would have been September 2nd, which it would have been 2 days ago. And we're at peak, and we're going to slowly go down, but we're not going to go that much down. That much down in the near future. This is the next 4 weeks, roughly. Here's some other supplemental statistics. I will get to Dr. Moriarty's estimate for Canada. I will get to that. So, I'm going to put a lap here. So, here is our supplemental statistics. So, overall for the United States in total for 2024, the United States has had roughly 192 million infections nationwide. That includes reinfections. This doesn't mean each infection here is one person. This includes reinfections. So, some of these infections in here could be someone getting COVID twice or 3 times this year already. 3 times would be especially if they're a child or a teacher, someone who works around the public a lot, or is in the school system will have more infections than someone who is not, for example. So, average percentage of the population that's infectious for the month is going to be 2.7% for about the rest of September. So that would mean roughly 40 million new infections during the next month as we enter October. And for long COVID, which is long-term impact from COVID, whether it be cognitive, chronic coughing, strokes, heart issues later, nervous conditions, immune disorders, whatever it happens to be, or maybe sudden diabetes, for example, whatever it happens to be, the resulting monthly long COVID cases for this wave alone, as well as adding on to those who already have long COVID and making it worse, is going to be anywhere between 1.9 million infections to 1.9 million long COVID cases to 7.6, upwards to almost 8 million. 7.6 is on the 20% of infections turn into long COVID. The 1.9 is on the 5% chance of the spectrum. So if we use the 10%, which is usually agreed upon by most people who look at long COVID, if we use 10% as a benchmark, then roughly we will be looking at roughly 3.5 to 4 million people gaining long COVID or having their long COVID worsen by the current wave if they get infected. Weekly infections are around 10 million, and then this is the weekly long COVID. These are both here for you guys just to make it simpler. COVID-19 transmission today, if you were to talk to a person, they might not realize this, but COVID-19 transmission today in the United States is currently higher than 91.6% of days of the pandemic. So that would have been all of 2020, much worse than pretty much all of 2020 in terms of transmission. The vast majority of 2021, except for the days of the higher days of the Omicron wave, especially the peak. A few days in 2022, a few days in 2023, early 2023, and during last winter's wave, a few days there, a week or two there. So this is really the upper echelon of COVID-19 within the United States. And here's your table here to judge your risk for social contacts. So, one person is a 2.8% chance that someone's infectious. 2 people, that jumped up to 5%. 3 people, 8%. 4 people, 10%. So I know a group of girls at the college. I see a group of girls at the college. I know at least 2 of them are ill. So, I know at least 2 of them are ill within that group. And they talk to others. So, there's 6 people in the group overall. So those 2 people are actively infectious, but there will be about a 50% chance that one of them is infectious. You can probably reduce that for 2. So it will be highly likely that next week that the rest of the group may be infectious, or they are already infectious but just aren't showing symptoms. This map uses CDC state-by-state data to show areas of higher transmission in deep red. I'm going to lap this just for guys who want to skip to this point in the video. So, the west and south are peaking. We already mentioned this, but here's the map. I will go over the actual status on the CDC website here, but almost every single state here has high transmission. Even this lighter pink is the lower end of high transmission. All of this dark red is high. Oh, this magenta is pink color, is high, and then this dark red, and then this very maroon color, that's all very high COVID transmission. So there's high to very high COVID transmission in pretty much every single state in the United States, except for Michigan. Michigan is close to around 1% of the population actively infectious, which may have something to do with previous policies in the earlier years of the pandemic by Governor Gretchen Whitmer, which is mentioned down here. So, regional variation by region. So, nationally, 2.8%. Northeast, 2.6% of people are infectious, 1 in 38 people. Midwest, 2.7%, 1 in 37 people. These are increasing rather quickly. So, this will probably be above 3% by next week. The South and West are below 4% now, but they're still at 3%, and they're slowly decreasing. So the Northeast and Midwest should overtake the percentage of infectious people, but the South and West aren't going down quickly. So there'll still be very high hotspots for infection. And here's the Michigan example. You guys can read this, but I basically just mentioned Mr. Hoger's point that Governor Gretchen Whitmer had more strong mitigations in the first 2 years of the pandemic, 2020 and 2021, because almost all mitigations in the United States were removed in 2022. That's when most mask mandates were removed. That's when most vaccine mandates were also removed. So we're also starting to get removed. So 2020, 2021 is what he is referring to when he mentions the first 2 years of the ongoing pandemic. And here's just everything for you guys in this package format where you guys can see everything. And this is the end of the paper. I will cite it and put it in the description for you guys. We'll do Canada first, but we'll do the Twitter one because the website that Miss Moriarty created isn't working right now. So the Canadian COVID-19 forecast, I'm gonna put a lap here, 17 minutes in. Canadian COVID forecast, August 31st to September 13th, 2024. So this is these 2 first weeks of September, and then another forecast will come out September 14th. In Canada, currently COVID-19 impacts on society is severe. Estimated infections this week for all of Canada as a whole is 1.1 million infections, or more accurately, 1.2 million to 1.35 million infections per this week. And then that roughly translates to, in Canada, about 1 in 32 people are infected. That's very similar to numbers that are in the United States currently. So if we go down, compared to the lowest point of the pandemic in Canada, infections are 25% higher, long COVID chance is 26% higher, hospitalizations are 20 times higher, and deaths are 18 times higher. And the lowest point of pandemic in terms of all of these would most likely have been May of 2021. However, I'm not quite sure what the lowest point was. I need to figure that out. But the lowest point of the pandemic in all these regards would have been most likely in 2021, once everything really got going with vaccines before Delta arrived. So here you can see it, and here's another graph, the COVID index score. The COVID index score, at least from what I remember, gauges COVID's impact on society. So it gauges its impacts on hospitalizations, deaths, the amount of infections, and the long COVID estimate, roughly. And Ms. Moriarty also has updates on how to help. And who is high risk? High risk is for people who are most high risk from acute infection. So the beginning state, the infections of COVID-19, or rather, COVID-19 is a disease. A SARS-CoV-2 infection, the immune response to that is what we're discussing when we're mentioning high risk. So high risk in that regard would mean vulnerable in those infections to death, most likely. Severe illness and death. But anyone's at risk from COVID-19. Even the athletes, if you saw Noah Lyles after his sprint back in the Paris Olympics, he collapsed after his run from his COVID-19 infection. Even though he was partying 2 days later, he collapsed from it. So it's important to make sure that you too are not overexerting yourself, even if you think that what you have is just a cold. It's probably not just a cold, especially looking at what time of the year it is right now. So things you can do to help: update your vaccines every 6 months. Currently, there is a new vaccine in the United States, I believe. There are new vaccines, mRNA vaccines by Moderna and Pfizer that are targeted at KP, I believe, 2. Yeah, or targeted at KP2. They're not the best. JN1 would have been the better target because that targets all the branches, especially KP 3.1, which is circulating right now the most. But it's also not free anymore. So the CDC Wonder Bridge program for free COVID-19 vaccines, if you don't have insurance, also ended this month. So you have to pay for your vaccine. But overall, you could also get Novavax if you want. But overall, it's a good idea to get vaccinated just so the acute infection of COVID-19 your immune system will be able to handle the virus better and not overreact and potentially kill you. And will also be able to stop the virus before it gets to a critical mass where it can get inside of your organs and become long COVID. Vaccines aren't as great at reducing long COVID risk, but they do help by a bit because they at least reduce it by 15%. The biggest thing you should do is wear N95, so I'm going to highlight this. The biggest thing you should be doing is wear N95 type masks. Masks are a primary way of stopping infection for COVID-19 because masks filter the air that you breathe, especially N95s. They are specifically designed to filter the air and make sure that you're not breathing in any aerosols that can infect you with the virus. And even if you do have a few that get in, the viral load that you'll be receiving is going to be low enough so your immune system will be able to deal with it and not cause an infection. And if you do other precautions with it, like staying distance from people, eating outside away from people, monitoring wind direction, and also just generally being sanitary, although that's less of a COVID-19 thing and more of a disease thing, as long as you keep hygiene habits, mask properly in all indoor spaces, and don't take mask breaks or stuff like that, and actually be careful what you do, you should be great. You should be good against COVID-19. So don't feel bad for yourself if you do get infected in those cases, because you did the best you can. It's the people around you who are failing. Avoid indoor social gatherings and avoid crowded non-essential places. If you don't need to be somewhere, it's probably a good idea not to be there. So social gatherings, indoors and outdoors, are indoors and outdoors. I wouldn't say if you're high risk. I would just cross that out. I would say for both indoor and outdoor social gatherings, don't attend either of them. Unless it's required, don't attend either of them because that's just an unnecessary risk. And then here's who is high risk, which would be for acute infection, which would be 60 people 60 and older, babies under a year because they do not have a functional immune system, pregnant women of all ages, and then immunocompromised or medically at risk people, or no vaccine or infection in the last 6 months. And what we mean by this, when I talk about this again, this is for acute infection. Acute infection where you feel the symptoms. This is not for long COVID. This is your chance of dying from an acute infection. So you not having an infection boosts your chance of having a severe illness because you do not have the antibodies there against severe illness. But getting COVID-19 over and over again will make it more likely that you get long COVID or any other disability, which can make your death rate go up. Maybe not from COVID-19 itself, but from other things. Miss Moriarty also has this by region. So we have Newfoundland and Labrador. So every single Canadian region is listed here. I will link the Twitter thread here, so you guys can check at your specific province in Canada. You can go through here, find your province, find the information that you need, and you should be able to carry yourself the rest of the way forward. So I will link this in the description for you guys right now. Okay, so last quick update before I end the video. In the Western United States, at least according to the CDC, the epidemic size of COVID-19 in the west coast of the United States, in Louisiana and Mississippi, the epidemic size is likely declining or is confirmed to be declining. Whereas in the Midwest, it is growing. In the Intermountain West, Nevada, the Great Basin, Utah, the Great Basin states of Nevada, Utah, and a little bit of Arizona and Idaho, those states are increasing. So is Montana. Minnesota, Wisconsin also increasing. Oklahoma and Arkansas are likely growing. Arkansas itself is growing, confirmation. And then Florida is likely still growing. And then Maryland, Pennsylvania are likely growing. And then New York, Connecticut, and North Carolina are likely declining. But that doesn't mean they're declining quickly. And then the New England states of Massachusetts, New Hampshire, and Vermont are likely growing or are confirmed growing. Every other state is stable or uncertain, or for the few states of Wyoming, Missouri, Alabama, and Georgia, they don't have any data. They didn't submit any data yet. So it's probably still high here, based on what we looked at earlier, but they're probably not doing any analysis here. So we already showed this map. I'll show you guys what variants are currently dominant, if I can show it. The current dominant variant is KP 3.1. I believe this COVID-19 variant has the flirt plus the FUQE mutations. So the main reason the summer surge has been going up so long, and has also lasted long in other places like the UK and Europe, is because KP2 came around, then KP2 plus flirt came, KP3 came, and then KP 3.1. So we've had multiple KP variants come through, and that's added on to the surge, where they negate your immunity to the previous variant, so you get infected again. So the waves kept going higher because of that, and also technically a little bit seasonal factors in the United States, but in Europe it's not seasonal factors. Cases were already high, and the Paris Olympics made that worse. So these are all the variants that are currently in the wastewater table, or have been logged in the wastewater table. So you can see we're in another phase of, there's a lot of variants out there. There's not one specific variant like there would have been in the winter with JN1, which was the dominant variant. There are a lot of different variants circulating around, so the wave will probably not go down as fast. And also, one variant doesn't necessarily give you infectious immunity to the next variant, and getting COVID-19 only gives you some sort of immunity against infection for about 3 to 6 months, and then effectively after that it tanks. And especially after a year, you're actually more vulnerable to getting COVID-19 if you had COVID before. But yeah, anyway, guys, I hope this video helped you guys out. So I'm just gonna make sure I link everything. I made sure I have all the timestamps, so this should be very easy for me to do. I just need to label the introduction, but I should have every single timestamp that you guys need. So I hope you guys enjoyed this video. Hope this was informative. Hope my Canadian viewers also learned something. I'm gonna post this video as soon as possible, and then eventually get back to my schoolwork and make sure I have a good rest of my day. Hope you guys stay safe out there. Make sure you guys get a good mask. Go to flowmask.com, go to 3M Auras, Go anywhere, get a decent mask. Make sure you get an air net so you can see the air quality in the buildings that you go to. And otherwise, just make sure you guys look at Michael Hoger, Mr. Hoger, and Miss Moriarty on Twitter. I'll link their profiles in the description. Make sure you guys go check that out. To get as much information as you guys can as possible. Get involved with the long COVID community. Talk to people. I know people may think they just have colds, but you gotta convince them that they don't. And I say overall, even if it is just a cold, no one wants that either. So you have to make sure that, gotta educate people. Gotta make sure we keep disease down because we want to be healthy. We want to have fun. We want to make sure that we're doing things. But some people realize that they can't do medical appointments. They can't do the fun things they want to do because there's so many people around spreading their disease because they either don't care, they have not been informed, or they simply do not have the resources. Especially for children, they don't have resources to be able to protect themselves. Parents are failing them in that regard, which public health has failed the parents. So unfortunately, that's how it is right now, especially with everyone going back to school. But yeah, I hope this video was informative for you guys. I will catch you guys later. I will try and do another video on maybe something else, on maybe a video game. I might do a weather discussion on Typhoon Yagi. Not today. I don't know if I'll do it today, but I might. But that's what I'm thinking of doing. So I'll make sure I have another important update for you guys later. Hope you guys have a good day, and see you guys another time.